This is the Buffalo Community Podcast, all about the greatest small town in the USA, the people in it, and how it all works together. Here are your hosts, Tyler Reiss and Mark Benzer.
Hello, everybody. Well, welcome to episode 60-something of the Buffalo Community Podcast. We have some familiar faces to a lot of people that have been around town for a while. Steve and Mariel Novacek of Optimal Function Health and Wellness. Mm-hmm. I got that right?
Physical therapy. And
Physical therapy. Gosh, dang it.
So close.
Sorry.
All right.
So
Sorry. Optimal Function Physical Therapy and Wellness.
Yes.
Thanks for coming in, guys. I'm glad you were able to carve some time out of your busy schedules to tell the whole world about the awesome things that are happening over there.
All 250,000 viewers.
250 million viewers.
Million, yeah, sorry.
That's great.
It's,
Blowing up.
Thanks for having us.
Yeah, absolutely. So what is it? Physical therapy and wellness.
Yes.
Expand.
Primarily right now, it is physical therapy. I am a doctor of physical therapy. We started about 9-10 months ago. I think we opened up shop and have been just getting out there, getting our name out there, getting some education out there, getting workshops done, teaching people how to move their bodies better, and it's been fun.
Awesome. And Steve, how do you fit into this?
So I'm a physical therapy assistant, licensed, and then I also work out at the gym that we're located in. So I teach at the gym that we're located in, Tova Fitness.
Okay.
So I'm doing more of the youth side or the sports side. She's doing more of the PT side, but the PT side's a little bit different for us. It's not your standard physical therapy. Like if you go to physical therapy because you have a shoulder surgery, you'd go to a PT and you do a bunch of exercise and stuff. But we do a lot more movement screening, or we find an ailment, then we find the root cause, and then we'll give you exercise, and then we'll work you out essentially. So we stabilize, mobilize, and then we strengthen.
Yep.
So we do continuation of a program versus just physical therapy.
Right. And I think that's probably, one of the bigger challenges of what you guys do, in that it's kind of like helping people, because I think everybody does assume it's like post-surgery stuff.
Correct.
It's like post-injury.
Yeah.
And what you're saying is we don't have to wait to get to that point.
Right.
We can use physical therapy as a way to like prevent all of that, right?
Correct. Yep. Yeah, that's the biggest thing we want to teach people, is that you don't have to wait. If you've got aches, if you've got pains, you don't have to let that turn into an injury and then get into the cycle of having to get into the medical world and orthopedic doctors and surgeons and surgeries and injections and things like that. Like, what can you do before you get to that point?
So how is it most people are, what's your typical, if you had to say more often than not, people are reaching out to you at what point?
It is usually, there are people who have gotten some injuries that will come, if they feel like they've strained something or torn something, they want to get that checked out right away, they'll come see us. But for the most part, it's people who have just about any pain: back pain, shoulder pain, knee pain, hip pain. And then we just help correlate all of that together. A lot of times you just kind of have to look at the whole, what we say, kinetic chain. You got to look at the whole body and figure out, is it something that, because of your feet, is that why your back hurts? Or is it something in your, is your elbow hurting because your shoulder blade stability and shoulder stability is not there?
Sure.
So it's just kind of fun to dive into that when they're coming in with an ache and pain and want you to fix their elbow. It's...
And the elbow might not be the problem.
Yeah, that might not be the problem.
Yeah.
That's why the golf outing was so much fun, because you did that screening, just the tightness in the back or the hips and your mobility and your golf swing and how everything correlates and how it affects you. And you may not even know you have that going on in your body, but it's there, it's prevalent. At some point, it's going to turn into an injury if you keep going down that same path.
Right.
So we want to hit that before.
Yeah.
So that's why those screenings are kind of fun to do.
Right. And some people scored better on those screenings than other people did,
Correct.
right?
Correct.
Some people were, pretty flexible and had good mobility, and other people, couldn't score.
Right.
Like they scored 0 points. Some people did that.
I'm not sure.
I don't know.
I don't know who you're referring
No,
to.
but I don't want to
Some
throw.
didn't.
Don't.
Yeah.
We won't say names, Mark.
Right, exactly.
That's a little too.
Is that bad?
It's Benzer.
Oh,
Yeah.
Maybe that's a little too.
yes.
No. So I mean, it's eye opening, you know, because you don't necessarily. I don't feel immobile.
Right.
And you might not be hurting yet.
Right.
But that's where we like to get into it. Is if even if you just feel tight, or if you just feel something's not right, something's not moving right with your body, you know, come see us now versus later when it becomes a problem.
And the hard part is, like, we all feel in our 20s yet.
Right.
But realistically, I'm not that anymore.
I do. I still see
Yeah,
it.
in my head, I can do everything that I used to be able to do,
for sure.
until it's time to try to do it.
Yeah.
And then it's like, oh,
Yeah.
And you hurt a little extra afterwards.
Yeah.
You get a little more sore. It takes a little longer to recover.
So you brought up a good point. Is you might not be in pain right now, but you might not really realize that you could feel better. Like, so maybe it's important to, hey, what the heck, let's go get screened and just kind of see, can we improve some movement? Can we do something a little bit different? I have a little personal story. In college, it was, man, I had hip problems and knee problems and then shin problems. And I go into the athletic trainers. I was in wrestling and, take my shoes off. She goes, oh my gosh, have your feet always been that flat? And that was the cause of everything. It was just that arch, everything was just bending in and just, it hurt. So it was kind of that, all right.
kinetic chain.
Kinetic
Yes.
chain.
Fun to say.
Kinetic
Isn't
chain.
that fun? Yeah.
I try to work
Kinetic
that
chain.
in whenever I can.
So, I mean, that really kind of hit home for me is like, you don't know how good you can feel,
Right.
because you might not be aware of it, or you just think this is how everybody feels.
Right.
I'm 40 years old.
Yeah.
I'm supposed to be in pain.
Right.
Right?
Yep. A lot of people say
Well,
that.
it just becomes the new normal, right? That's my limiting factor. I'm just not going to do
Ooh,
that.
new normal. I like that.
We haven't heard that before.
We haven't heard that. Yeah.
We say that a lot.
Yeah.
No.
That's my new normal.
Right.
Yeah.
Yeah, and it
Exactly.
Well, no,
And it doesn't
that
have
shouldn't
to
be.
be.
It shouldn't
Right.
be your new.
Right.
Right.
But people get used to it.
What inspired you to get into this space?
Ooh, that's a big question. So I can go back a little ways here. I was an athlete, and so I loved just movement in general. Excuse me. And then when I went to college, I was trying to think of, what do I want to do? And I loved learning about the way the body moved. Okay, so that makes sense. Exercise science, kinesiology, kind of went that route. And then I'm like, okay, now what do I do with it? And then it was personal training, and I decided, well, it's either that or go back to school. And at the time, I wasn't ready to go back for master's or doctorate. And so I said, I'll personal train. And so I personal trained for about 5 years and realized I was taking all the post-rehab people, and I was really trying to dig in and do my research and really learn, why is it, why can't I progress them better? Why can't they get stronger, faster, and things like that. And so I was digging into that. And then all the other trainers were like, here, you can have the post-rehab.
Yeah.
Because I became the post-rehab personal trainer. And I said, I need more. I need more education. I need to become a physical therapist. Went back for the three years of doctorate program. And even throughout then, just thinking, I always wanted to have my own practice. I think it was always in the back of my mind. My parents are business owners, and I just always loved that idea of that flexibility. And the more I talked to Steve, once we were married, and he's like, I like that idea too. And we kind of, the COVID thing last year helped us kind of dive headfirst into it. I don't think it was our plan to do it quite that quickly, but I was put on furlough at work, and it just, gets the wheels turning
Yep.
a little bit more, and start thinking about what you really want to do with your life and what you want to do. You want to create that work-life balance, that family balance, create the time freedom, things like that. So we're like, let's do it.
Yep.
So we
And
dove
then
into that.
Yeah.
So
And then you
Yeah.
realize there is no time freedom with owning your own business.
a little bit, yeah.
Like,
a little bit.
oh, I thought I was going to have more time.
Yes
Yeah.
and no.
Yeah,
Yes
right.
and no.
That 3-day schedule turned into a lot of nights and some weekends.
Yeah,
Right.
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 Steve, your story is
okay.
kind of cool. Like most guys who graduate from Buffalo High School, oftentimes go on to coach Division I and Division II college volleyball.
Yes. Yeah.
And your story is no different.
Correct. So I took that path.
Just another one.
Just another one.
No, I loved the coaching aspect of what I got into in college, and then it just continued on through grad school, and then it led to some D1 coaches at NDSU and my last stint at Marquette University, and I absolutely loved it. The hard part was the time that we talk about, especially having a little one at home, and you're just gone so much, nights, weekends, recruiting, you're traveling a lot. But that really led me to youth sports, and I just love it. You know, that's why I continue with the CrossFit gym. That's why I'd like to do a youth sports movement, and we've talked recently about possibly opening up a youth sports facility combined with physical therapy, and really getting young athletes before they specialize.
Sure.
Is the big thing. Like, you got a baseball player who's throwing 100 pitches every other day, and it's like, what's that doing to shoulder at 12? So it's that's my goal eventually.
That would be an awesome facility. To have in town here.
That's our big goal. Yeah,
that's our big goal.
One of our big goals.
But I really like to dive into that just because of the background, like you said, the coaching stuff that I did for about 15 years and traveled around the country, and it was amazing. We met a ton of people and went to some cool places. I got to go to an Italy trip where we both did through that. So I really have that passion just to give back to youth sports now and to make sure kids are doing it right and they're fundamentally sound before. Because you see so many burnouts, or you see so many ACL injuries, shoulder injuries, and it could have just all been prevented if you just take care of your body.
So would you suggest one sport athletes or try multiple different sports?
No, absolutely. Try as many sports as you can at a young age. When you get to that sophomore, junior, senior, then specialize or be more active in that sport, but don't specialize until after that 7th, 8th grade year, 9th grade year, because you're still developing. You're still growing into your body. You see, like, we saw so many young female athletes that just specialized in volleyball from 12 on. But you ask them to shoot a basketball, or you go to kick a kickball, and like it's funny, can't. Like it's like a deer on ice. Like, it really is. Just because they know that one sport and they do it really, really well, but ask them to do something outside of that, it's tough.
Sure.
So that's when your injuries occur, just because they're so dynamic in that one position.
And how are you creating lifelong wellness too? And because college ends at 22. What are you going to do the rest of your life?
Right. Go pro.
Yep, you could go to Europe.
Small percentage that goes pro. Or plays beach volleyball.
Beach volleyball or sand volleyball at the local establishment.
Correct. Right. Yes, that's your future.
Champs. Champs. So what's one thing that you wish the general public knew that's just a common misconception about, just that overall wellness and that physical therapy, just kind of that, what's that one thing you just wish everybody knew?
About physical therapy?
Yeah, but what you guys do, kind of like, hey, your life might be better if you just knew this.
Sure. You go first.
Okay,
I'll go first.
I guess, I was just going to say, let me think. So the kind of what we were saying before, you don't have to wait. Physical therapy isn't just about waiting until you're hurt, waiting until you're injured, Come take care of it sooner than that. That's the biggest thing.
Yeah. And mine would be movement is medicine. Like, if you want to move, or if you feel a tight back, don't rest it, move it. Like, the biggest thing that I hear, like an athlete, any age would sprain an ankle, and like, I got to rest it. Well, that's opposite of what you want to do. Because if you rest it, it's going to get stiff, it's going to swell. You ice it, it's going to get worse. Move it, mobilize it. Change directions of it so you get blood flow to the area, right? So move that body component. If your low back hurts, do exercises to move your low back, right?
Which seems counterintuitive to a lot of people.
Yeah.
I mean, even myself, when I strain something, it's just a human response to go, protect it. And so when I hurt my shoulder, I rested it. And then, within a day or two, I was going, it's getting worse. I should know better. And I started moving it. And
unless you break a bone or something's broken or you tore your ACL, those are limiting. Don't move those, right? But for sore muscles or sore anything, move it. They say the best thing to improve just general mobility is just squat once a day. Just see how your body is moving functionally.
Sure.
Do you have aches, pains? If you do, then if tightness, then move it, fix it.
Very cool.
I feel really good about my gamble last week to golf. I fell off a ladder it was like the second step. I landed on my feet, but it was just enough to jar me.
Sure.
And it was just so sore. But then it was the chamber golf event.
Yep.
So I called Mark up and I'm like, hey, you want to go golfing at Heights? And we did. And I said, this could be the absolutely best thing is to just kind of get loosened back up, or it could be the worst thing.
Sure.
And I'm not going to be functioning tomorrow. Turned out pretty well. So I'm glad I had no knowledge of it, but I had an hour free. So
that's right.
But that was kind of that whole, move it, and it got better, and I feel fine now.
Yeah.
But anyway.
Yeah, and if you start moving it and it makes it worse, that's the time. Come see us.
Yep.
So
very good.
Mariel, you have history. If we kind of go back to your Buffalo roots, obviously born and raised, as far as I know, right?
Yep.
At least raised.
Yep. Born and raised here.
Yep. Okay, and your parents owned a business and still do own a business in town for
Yep.
how long?
Can't get him to retire.
Shout out to Gardner's Hallmark.
Yeah.
Yep.
So.
Oh yeah, I think it's 40 plus years now. So, yeah, we can't get my dad to retire. We're trying.
Yeah, and who's your dad?
He's getting there. Bob Gardner.
Bob Gardner.
Yep.
Gardner's
Gardner's Hallmark. So Bob and Marilyn, they have run that business for
a couple years.
I think, a few decades.
Decades. That's
probably actually kind of shocking to hear that he's still working. Like,
he loves staying active.
That's awesome.
He's got to be busy. So.
Yeah, that's good.
Yeah, as far as staples of the community, I mean, if there aren't too many.
I don't think anybody calls it the Hallmark store. It's Gardner's Hallmark.
Right.
I mean that's always been referred to as Gardner's Hallmark. Yeah.
So the roots are deep here. Connections run strong. Steve, your story isn't all that much different. So
born and raised.
And it's nice, and that's why we wanted to come back to Buffalo after I was done coaching and chasing that dream, and we did that for a while, and it was time to move home. Like, we knew we had connections here, we had friends here, we had classmates here. Like, we knew we could, if we're any place we could open a business, it would be here because we knew people, and it would be an instant network. And we've seen some of those people trickle in, and people have congratulated us and say, "Hey, good job opening a business and whatnot," and I hope it goes well. But it's been awesome as far as the support and the feedback from the community. Just being here in a small community and knowing a lot of people, it's been awesome.
And what would you say is like, I think when you get into something like physical therapy, that's what you want to do. Like, I want to get my hands on, and help. When you get into that business ownership side, you probably, you spend a lot of time as a salesperson, right? Like, where it's just like, all you want to do is what you have a doctorate in.
Right.
Or what you're licensed to do as an assistant.
Right.
And you find out, I'm just kind of speaking from my own side of the insurance
very
where
true. It's very true.
What's that experience been like in terms of wearing so many different hats?
There's a big learning curve the last 9 months.
Especially with social media. Like, it's constantly evolving and changing, and you're trying to do marketing and you're posting things, and it's just never enough. Like, it's just this time suck of writing every day or posting every day or trying to get people involved and running workshops, and you're marketing nonstop. For your ratio of treating to marketing is 10 to 90 right now. Just because the stage of the
just
program stay where we're at.
Yep.
So it's been a huge learning curve, like she said. It's just been.
And that's why we love doing those workshops too, because we're not necessarily hands-on with them, but we're right there and we're teaching. And yes, it's marketing, networking, that's part of it. But more than anything, it just helps us get our knowledge out there. It helps us teach people movements, and that's what we love to do. So that's kind of the best of both worlds when we can get those workshops going and get people excited about moving.
Awesome.
So,
how can they get a hold of you?
Well, we've got a phone number.
Which is?
Okay. Would you like the exact detail? 612-756-9757. We've got email, admin@optimalfunctionmn.com. We've got our website, optimalfunctionmn.com. And you can book online. You can scroll down to the bottom, and there's a way to, you click on that, and you can actually try to book a service online, kind of like if you're going to the hairstylist or something like that. We've got that service. And
do people need a referral to come see you?
No, that's kind of a common misconception. Minnesota actually does have kind of a 90-day window of time where they can have direct access to us. So they can come see us. And that's part of the doctor program too. We screen for red flags. We can kind of tell this is something that's going to need imaging, or this is something where you probably should go see an ortho doc, or maybe this will require an injection. We understand that there is that.
What do you mean by that? 90-day window of you can come and see us.
So like when we talk direct access, it means you can call us, make an appointment, come in and see us. You don't have to go to your doctor first, get a signature, get the referral, have it sent over to us, things like that. You can just call us directly. And so in that 90 days, which is actually a large window, because typically we know if we're going to get you better within those first few weeks.
Sure.
Or if there's something else going on. So you typically don't need that whole 90 days to figure out if they need a doctor's referral or if they need something else. But Minnesota does give you a good amount of time to be able to do that.
So we can see and treat you within those 90 days. If it goes over 90 days, then we need a referral. But as long as you're done with your program or you're done with that physical therapy in 90 days, you don't need any.
Some of that business side of it, of rules and regulation.
Yes, making sure you follow them.
Okay, thank you for clarifying.
Rules, schmools, that's what I say.
I wish.
And then part of the wellness side, too, is we're diving more into, we don't want to call it personal training, but we're doing the continuing of care after personal or physical therapy. So then we'll really dive into the strengthening aspect of what you're doing. So if you want to get, if your goal is to run a 5K, we'll help you achieve that goal at the end. So you come in with a hip pain or knee pain, and then all of a sudden we're deadlifting in week 7 or 8, and you just want to continue on gaining strength. We also do that continuation of care as far as the wellness, which you can still run through your insurance program or your HSA, which is nice.
Yeah, absolutely.
Excellent.
Well, guys, are we missing anything? Did we not touch on anything that you're just dying to tell
The world,
the community?
250 million viewers.
250 million viewers.
Not off the top of my head. I think
we covered a lot of it. It's good.
a lot.
Well, thank you so much for coming in.
Thank you so much for the time.
For the Buffalo Community Podcast. I'm Mark Benzer.
I'm Tyler Reiss.
He's Luke Edlund. You are
Steve Novacek.
And you are
Mariel and Novacek.
Thank you.